My name is Ron. I'm with I'm the CEO of Bay. We're the corporate sponsor of Res. Appreciate all of you being here today. The word Bay in our Anishinaabe means let's go. I'm a travel member from the Little River Band of Ottawa Indians, the music group, but a tribe up in Michigan. My tribe was actually organized as a tribe in '94, not that long ago. Isn't that amazing? We have so much information to share with you today. We're going to do a quick introduction. We're going to walk through the opportunity for all of us, for our tribes. This is not a sales pitch. This is education. We have so much opportunity, so much opportunity. I'm really excited to share everything with you guys because really the big vision, when we all come together, our tribes together as one, we become a powerful voice in DC, don't we? Mm-hmm. We do. And so you're going to hear some great information today, ask questions, and we'll get through this very easily. So you're going to be really excited about it. So why don't we start with the information, or introductions? Yep. Shane Urry.
Shane Urry, Vice President of Ambe Health.
I'm David Sullivan, the Chairman for the Kiowa Tribe.
I'm Marcy LaFleur. I am the Director of Behavioral Health as well as the Kiowa Healing Way Director for the Kiowa Tribe.
Karen Knight, I'm the Vice President of Business Development with Face Rock Enterprises, which is a tribal consulting firm.
Hamilton Baden, co-founder and CEO of an organization called U-Turn Health. We work with Ambe to provide extremely innovative behavioral health services to the tribes.
Hello, I'm Martha Ketcher, CEO, owner, and founder of Yama Consulting Services, partnering with Ambe Health and Face Rock Enterprises.
Thank you. So let's get started right off the bat. We're going to talk about.
Press down. There.
So let's talk about some opportunities that actually help us get started in healthcare with the ability side. Well, actually, before we get started, we're going to talk about self-governance and why that's important for our tribes. So Chairman Solomon, if you would share why self-governance is important to the Kiowa Nation and to other tribes.
Sure, thank you, Ron. First, I want to say thank you to Ambe and for all of you for joining us. I know Vegas is fun, so it's an early start for some of us. But, for me, it's been a great privilege to be able to work with Ambe and work with our tribe. Self-governance for us, I mean, we all know, I'm sure most of you know, and Marcy will give more of a background on the details, the law, all of that kind of thing. But for us, for the Kiowa tribe, it's vital for us. We are just in the final stages of obtaining that self-governance status with the BIA, and also we're working on that same process with other federal agencies, including IHS. And so what that does for us is it provides just a new level of sovereignty, a new level of control for us over the federal dollars that are provided, that are assigned or for our use. And so it's a better option for us. So because and especially in the context of health and providing those services to our people, because without we could say, okay, IHS, you keep doing your thing, but we know the research is there that when tribes control their own health systems, it's so much better. The people flourish. We understand our own people. We understand our own culture, our own language, and how all of those elements fit into the health system. And so when we have that option, we have that control, that sovereignty level, then we are able to incorporate elements that go beyond just the Western medicine. We can incorporate our own cultural healing practices, and that's what we're going to do. We are doing to that to a degree, and that's what, I think at some point you'll talk a little bit more about the Healing Way, the Kiowa 7th Generation Initiative. We're in the process of making some changes to that. But that's, to me, in a nutshell, is what that means for us. And I'll stop there. I could just keep talking. I know we're going to have a good time.
Awesome. Thank you. So you understand a little bit why it's important. So what's amazing, what we're doing here together today is working with this tribe and this tribe and this tribe and bringing us all together. It's kind of the theme of the Res Conference, right? Rising together. So this is going to be very important. A lot of times, most every time, tribes ask, how do we get started? We don't have the funding. So we're going to talk through that right now. We're going to explore 3 types of funding available to the tribes: 105 leases, pre-award, and 340B. So let's talk about the 105 lease program. Who wants to start first?
I will.
Marcy. Marcy from the Kiowa.
Yes. I oversee the behavioral health programs, and as Ron said, one of the problems we had is economically, we're a smaller tribe, so we don't always have the funding, and we didn't know how to utilize that. Just getting our self-governance, we were able to utilize the 105L, and what that means for us is, without that, we actually had to, and all tribes do, you have to kind of finagle your way to make sure you're covering the money that's supposed to be for your programs and your services. You're having to use that for construction. You're having to use that for paying different avenues just to get it started. And that's where it's really missing a lot of things. And the 105L lease actually comes in and says, we are going to go ahead and help you establish that so that the program money that you have, you actually get to use it for your tribe and your people for the services that are there. And, so the best part about it is, for me, the federal government pays the lease. So that's what that is. And it's part of the compact. It's just part of the compact funding. So it's really separate from there. I think that's something that we've had to step aside as a smaller tribe, and to be able to get to know that. We don't know all of those ins and outs, and luckily we were able to work with the team here to kind of step in and help us explain it to us, explain it to the people that make decisions for us and help us make decisions for being more informed. But the 105L, I'm going to let Martha add on to that a little bit more. Sorry.
The 105L lease is the advantages to the 105L leasing is that any space that your health program occupies that's within your ISDA contract is eligible for 105L. And that can include a lot of different spaces. So the guidance that we use to distinguish what is eligible for 105L is those programs, functions, services, and activities, those PFSAs that's identified in your scope of work. And it could be the storage that supports the health department, where you're storing your materials and your supplies that supports the health program. The 105L leasing can encompass the nutrition program that may be not in the health department, but in another location. But that facility, the square footage, I mentioned the nutrition, but also the community fitness. If you have a community health in your scope of work, those fitness centers that you're utilizing to improve the health outcomes of your community, that space is eligible for 105L. So when you think of 105Ls, don't just think about health where you're delivering care. Look around you, what other PFSAs are being operational at other locations, and that space is eligible for 105L. And that's a good resource to help supplement healthcare income.
And I think you need to remember that it's for BIA, BIE, and IHS programs, so those can all receive funding on that. Ron, if you'll jump back just to that last slide, because there's 3 ways that you can configure 105L. You've got the fair market value, which is the rental value. You have the combined fair market value plus the utilities. And then you have the expenses only, such as if you have a rental agreement, maybe you're renting the space. It doesn't have to be on tribal land. So if you're renting a space, you get the full value of that lease plus the utilities. So you can figure that. And also, when we're talking about expenses, we're talking about P&I too as a possibility. So you can get those costs in there when you're going to buy, you're going to build a new building, you're going to finance a new building. You actually can get that, and a lot of banks are working with tribes to use that as their down payment. So you have a way to finance those type buildings. So remember, you get to claim the buildings that house programs programs that support programs like Martha was saying. So you may have a program, maybe it's maintenance or maybe it's IT, or there could be something that is supporting that could be at a different location. You get to claim that program that supports it too. You may store your lawn maintenance equipment and snow plows or whatever in one area. That supports that other program, so you're able to claim that.
So I have a question then. So we're talking about our buildings within the tribe. So if we have a gymnasium, you mentioned sheds, storage, all that stuff. All of that falls under the 105L.
Correct. Correct. As
And-
long as the program that's in your ISDIA, if you don't know if that program isn't in there, that's something that can be added in. So it's not like, oh, we can't do it. You can actually get that amended and added
So
in.
long as it's a PFSA of that
Correct.
agency. You mentioned gymnasium. Well, do you have community health in your scope of work? Wellness and fitness programs in your scope of work? Then that could qualify. I think she mentions the various options of 105L leasing, the fair market rental value, the combination of the two, or expenses. Some of the things, based on my experience, is those expenses, how you're tracking those expenses, can just kind of, as a guidance in the expenses, it has to be by facility. And sometimes we have found where programs are consolidating those expenses under one account. Well, you need to break it down by facility if you want to claim the utilities and so forth for each facility. That tracking mechanism, you might have a different, set up different fund codes for different satellite office clinics, for example. Those expenditures are some of the things that slow down the process, just trying to allocate. So maybe you want to look at a cost allocation plan when it's consolidated expenses to break it down to the different facilities. I've seen it broken down by square footage, for example. But that's some of the things that you want to consider in breaking down those costs.
Yeah.
I was just gonna add a comment to that
Yes.
too. Sorry. I was just gonna add a comment to that. When you're looking at your contracts, and that would help, contracts, or you're writing grants, or you're doing any of that, the language that she just said, wellness center, health, add that in, because that opens it up to where you are able to incorporate those things into what you're doing. And that will help you actually apply, or be able to apply some of the 105L more feasibly if you can show it that way. A lot of times we get so focused on what we're writing and become so specific, so you need to make it a little more broad, adding that language in there, and those words really help out.
We're seeing, remember, the property that you have doesn't have to be located on tribal or trust land. So you can, if you've got some property that you own that you want to put that 105 on, you can. Also keep in mind that this is annual renewable. So after they'll prorate it the first year, and then when it comes back for renewal a year later, you'll have the opportunity to sign that renewal automatically and say, yes, I want to continue with that. Or maybe you had a lot of expenses. Maybe you replaced an HVAC system, or you did something to that building. Or maybe the fair market rental values have gone up and you want to renegotiate. You'll keep your same lease number, you'll just renegotiate the terms of it. And right now, a lot of tribes will have the Title VI programs for elder nutrition. They may put it under BIA, or it could go under IHS. You have different programs. You can move them to IHS if you want them, or you can put them under, you can keep them under BIA, however you'd like to do it. And Martha can speak more to that and advantages on that. But keep in mind that once you file your 105 lease, it's about 4 months till they process. Right now, it's what they're running. Now that could change with IHS. Now, the government shutdown was not a friend to BIA, and so they're running about 11 to 12 months on that right now. And that could change, but that's how long they're taking to process those leases.
That's with the BIA.
BIA.
Yep.
So those are programs that are non-health related.
How about Indian Health Services?
4 months right now.
4 months.
And they'll issue the full amount of that full year, and they'll prorate it, so you'll get one payment that will have that full amount in it. Martha, is there anything else you want to add?
No, I think you covered it. I think the simplicity of adding a PFSA to your ISDIA contract is relatively easy. Let's say you do have a fitness center in your community, but you don't have community health in your ISDIA. Well, we'll write a scope of work that incorporates it, because wellness is a part of IHS PFSAs. And it's easy to amend that scope of work, but it has to be in the scope of work of that ISDA contract to be eligible for 105L. And typically has to be in your service delivery area.
Awesome, thank you guys. What an amazing opportunity just to get started on the building side. Now we've got that covered. You're gonna have questions now, but now we have it covered. So let's go to the next one. We're gonna talk about pre-award funding. A lot of times the tribes are asking, again, how do we get started? We're gonna talk about pre-award funding, everything to get started, get moving. The goal is not to, for me, it's not about knowing everything, but the goal is to get started. Because once you get started, you're gonna learn so much more information. So Shane, if you would, start with us and talk about how building up tribes, it's not, again, not a sales pitch, but really any tribe can get the help needed to get started, and how does that work?
Yeah, I think when we do get started and working with the tribe, you know, in the early stages of the foundation, you know, a lot of tribes ask that question, you know, how, you know, one, we don't have a lot of funding available to start this. It costs, you know, money to buy the supplies and to pay for consulting services and to buy the equipment to start a facility. And what does it cost to, you know, amend a 638 and get that process started? Well, all that is covered under the pre-award and startup funds, which allows those dollars are allocated. It's not a grant, it's actual dollars that are allocated at the area level and utilized and given to tribes to start these programs that we're adding to the new ISDA 638 contract. And so kind of the process of what we do is we'll evaluate, all right, once again, if we're opening a primary care clinic and we're opening a pharmacy, what are the actual costs associated with opening these facilities? We talked about the 105, that covers the building part, but from an operational standpoint, the equipment, the supplies, the staffing, the training of the staffing, the recruiting of staffing, all that is covered. The pre-award covers up until the time of negotiation with Indian Health Service Area Office, and then once the negotiation happens, we select an effective date of the new ISDA agreement. The startup costs for the first 12 months are paid for through these startup funds. So the operational costs to pay for staffing, to train them, the equipment, the operational costs for the first 12 months is paid for through this program. So it's a fantastic opportunity for tribes who may not have dollars sitting around to start these programs. These dollars are used to stand up the pharmacy, the clinic, and any of these programs that are being added. But Karen and Martha can probably expand on what I was talking about.
Yeah, and I think one of the key factors is this is for a new or expanding program. So maybe you have that program, you've already taken your shares with your PFSAs. Maybe you're going to expand that program. Maybe you're offering something you've never offered before. And this is an opportunity on that. And then this is going to cover some of those contract support costs that we're talking about, is what's used to start up an issue. That Martha, do you want to elaborate a little bit more?
Okay, thank you. The really key thing here is if you're going to expand your scope of work to include a new PFSA or you expand it, is get that letter of intent in. That letter of intent, if you are going to plan to incorporate a new program, that LOI is really key, because from the date that you initiate that letter of intent, you're notifying the agency of your intentions to expand that PFSA. And that it's in the policy of the agency that to qualify for pre-award, they have to have that letter of intent. And that letter of intent identifies the estimated cost of that pre-award projection. And that includes, as he said, the consultants, the legal fees, some supplies, and so forth. But just identifying the nature of the cost is really relevant too in the LOI. So the amount, the nature of the intent, and within the policy guidelines. And you can go back, say you don't negotiate until you initiate the letter in June and you're not negotiating until the end of December. You can go back as far as June, the date of that letter, to claim those pre-award expenses. And after you sign, are we going once you sign that award, then you start that startup cost and documenting your startup cost after the award.
Marcy, do you have?
I'm sorry, go ahead, Marcy.
I was just gonna say, on the tribal side, when you're doing your startup, and of course, trial and error learning, you really want to know what your constitution, if you have, resolutions, if you have to have that, who in your tribe has to approve these things. Those are very important to know within each tribe as you get this started, because you don't want to start the process, get halted because you didn't follow what your constitution says or something else. So you really want to make sure you're engaging with all of the heads that make decisions and get that buy-in from everybody first. It just makes it a lot easier.
Yeah,
That's a great point. You know, I'll just add to, you know, I think a lot of tribes get the focus of providing just primary care or adding pharmacy, right? But there's other programs. You know, we've had success in adding behavioral health. You know, tribes that have need in adding mental, behavioral, and substance abuse programs, starting a whole new program under this, and that's all covered under this pre-award. You know, services like what Hamilton can talk about, and he talked about on Monday. You know, peer-to-peer coaching, and truly, a tribe has the opportunity to customize their program to their tribe, making sure that obviously the cultural aspect is taken care of. But I think that's important to know that. You know, it's not strictly just focused on primary care or pharmacy, but there's our other programs like behavioral health, physical therapy, a lot of the programs, and you know, just it's important to look at the tribe as a whole and see what the needs are of the tribal members, where the tribe can utilize these funds to open up new programs.
Isn't that amazing? So now we've got the building side, now we're gonna bring the operation side, bring all that together, because a lot of the stuff is coming. So we had, so how long does it take from the time we start to get to the pre-award?
Well,
let Karen.
it depends on a lot of things. You're going to start with that pre-award letter that Martha mentioned. So you send a letter, and then everything, once that letter is accepted, it will come back from IHS, and they confirm that the letter is received, and they acknowledge it. And from that point on, any of the charges, any expenses that you incur from that point on will be included in that. Time that your staff spends working on this project also gets reimbursed too, so you have a lot of different things that you can track and keep, and I think Kiowa's been doing that all along, so they've got quite a bit built up. But from the time it starts, you're going to start that, then you'll start planning to add that in. So you'll add many of the different programs, look at what you're going to do. You'll meet as a team, you'll get a tribal resolution first that says we want to expand this program or this new program added in, and once your tribal resolutions received, then you can start designing your program, and you decide what you want to add into your SDA. Maybe you don't have, maybe you're not a 638 tribe, you don't have an SC and you'd like to get one. Now's the time to do it, and you can just add that program in, and your cost for doing so will be included in this. So it's a really wonderful program in there. So first that goes in, you have your letter, you start incurring your expense. You go to the, after that you will go to time of negotiations with IHS, and you're gonna have a technical advisory meeting to where you can find out, well, you do your budget, you'll get everything gathered up, and Martha, I'll let you kind of elaborate more on all of that part.
In that pre-award phase, you're working with individuals consultants maybe, who are collecting the data. You want to do a letter of request for data to the agency, requesting the tribal shares, the program dollars, and a lot of little details go into culminating that, pulling together that budget submission. It's the tribal shares, the program dollars, but also the details like your direct contract support costs, which entails a lot of the details on your fringe benefit rates and what makes up that fringe benefit rate. Because those elements are included in the direct CSC. The other is having a current indirect cost rate. The agency will only recognize an indirect cost rate that's not older than 3 years old. So if you have a rate that's older than 3 years old, you might get stuck with doing a detailed analysis on indirect light type costs or a de minimis rate of 15%. So it really behooves you to keep those IDC rates current because they'll become very relevant in submitting this proposal of capturing indirect costs. There's very detailed CSC templates that go into with this policy and the funding table. That funding table will capture all of those and bring it together, your program, your area, your headquarters shares, and your CSC analysis. All of that coming together with your pre-award and your startup costs when you get ready to go to negotiate this, all of that will be captured in this funding table.
Amazing. So you can see where we're going. We started with the building side, now we're bringing all of our costs together, but can we create revenue? How do we make money? How do we help support the tribes? How do we lower our costs of not only bettering our health, lower the cost of healthcare, not only for us, but for others? So let's talk about the 340B. How does that work?
There was one thing that I think we forgot to mention when we neglected to, and some changes happened in 2025 with IHS. Used to, when you did this pre-award and startup, you would do your pre-award, you'd incur all your costs, and then you would submit that and they would issue a check for that full amount. And then you would have all your costs that would go for the full year, and you'd submit that and settle up at the end of the year. But in 2025, they started paying up front for those estimated costs. So you got paid that money up front at the same time as the pre-award. So they'll now do the whole pre-award and the estimated costs up front for that full year, and you get that in advance. So that enabled more tribes to participate than what they could in the past, because you're not having to incur all that cost and then wait to be reimbursed after a year. So I think that's a really, really wonderful change that they made.
And we're not talking about selected tribes, we're talking about every tribe as
Yeah.
such, right?
Yes.
So let's talk about the 340B, because we're in crunch for time here. So how does the 340B work?
The 340B program is a program where you can buy the lowest cost pharmaceuticals in the country. And you always hear a lot of talk about that. Everybody wants a piece of that. And there are only a few organizations that can apply for 340B, and that's going to be hospitals, federally qualified health centers, rural health clinics, and tribes. So what happens is there's an application. You can only apply the first quarter, first 15 days of the quarter. And the first 15 days of the quarter, you need to get your application in. The application starts out as 126 pages long, and it's quite, you should look at it and go, I don't even want to look at this. But the minute you click tribal, it drops down to 3 pages. And it takes, we've had races with tribes who are doing it, and I think the longest it's taken is 10 minutes. So it's pretty quick. Once you're registered, and you're registered under HHS, and it goes under HRSA, so you're registered, you do not have to open a 340B pharmacy. It's a mechanism to buy medications at a very low price, and we'll get into that in just a second. But you're not obligated. I have one tribe that had their application in, they got approved within the next quarter, and they can begin ordering medications at that price. They can be, and they started that, but it turned out that they weren't ready for that. So they waited 2 years, and then they got going. There's no cost for it. If you don't want to do it, you don't have to renew, you can remove it. But right now, we all know how it works with federal programs. If you get in, you're in, and they'll grandfather you in for everything else they change. If you don't get in, then you may be locked out. And so I would say if you don't do anything first 15 days of April, I would go ahead and get signed up, and we can always send you a link on that if that's something you're looking for. But it takes about 10 minutes to get signed up. You can open a pharmacy or not, but it's one of the biggest money makers. Some tribes are making more money through that than they are gaining. So this is a very good thing for tribes. Plus it provides access to medications that you can't get on that IHS formulary. Sometimes on that formulary it's very limited, so you may not get all the state-of-the-art medications. So let's go to that next. Yeah, go ahead.
Shane mentioned, if you can just jump in here for a minute, Shane uses a drug that we use quite a bit with other tribes, which is
Without 340B?
without 340B.
You can see that top list there, Humira. It's a very expensive drug, about $7,000 to $9,000 a month, and tribes through the 340B program buy it for 2 cents. So you can see the value of the 340B program. That's one drug of hundreds of drugs on that program, and as Karen talked about, IHS uses the VA Prime Vendor Program, which 340B pricing is much more aggressive than that. So the tribes have the opportunity to expand their formulary and have access to these lower cost drugs, which in turn helps them, drive significant revenues, as Karen alluded to. So very broad breadth. We see a lot of Jardiance. We see a lot of obviously Ozempic, Manjaro, GLP-1s. You can see the cost difference there. So it's a fantastic program, and as Karen talked about, the key is if we're going to add and do this program, making sure that we get registered and get in the system so that the tribe is prepared to if they need it or not, to have that ability to buy those drugs at the following quarter.
Anybody else want to add anything to that?
No, I think the biggest thing is make sure that you can get access to that, even if you're considering it, not sure you're going to, go ahead and get registered. And the medications, it's a game changer, because if you're using the IHS formulary, they can't afford, if you look at the price on that, they can't afford those medications to get everybody on them. There's just not enough money to cover that. But if you can get, maybe you've got a lot of people with diabetes and they benefit from those GLP-1s and Mounjaros, Ozempics and all that. A lot of people can't get those unless they've got neuropathy. They've already gone into the full-blown stages of diabetes. They're looking at major problems. Then they put them on. But what if you were to get that before that happened? And so as a tribe, you can see probably 3 or 4 people for the price it would cost for one, so there's a chance to really make a difference in health outcomes. And so you get access to all kinds of state-of-the-art medications that they can't afford to do on IHS. And I think, it's really important. Remember, you can still use IHS, you can still do that, but it'd be great if your tribe can supply that for people. And it makes a difference in communities. I mean, if you have access to all the medications, all the great medications, and you're paying pennies on the dollar. I had one tribe that they had 6 people in their tribe that had rheumatoid arthritis, and they were doing PRC claims for it and it was costing them $189,000 a month. That's outrageous. They had the Humaras and the really big expensive drugs. Well, they had a pharmacy, so what they did is they went ahead and they got on a 340B program. They purchased all the medications for those 7 people for $19,000 a month, and they turned around and billed and got paid $165,000 a month. So the program will pay for itself and will help, but the 340B does not cost. It's just a way to buy it at the lowest cost. So I can't encourage you enough to be sure to get signed up. There's all kinds of people that can help you with this, but let's get signed up for that first.
I'll just add, as a tribe, if you have a self-funded health plan and maybe you have tribal members that work at the casino or one of your entities, most likely that insurance is paying, and maybe they're on Humira, right? The tribe's paying $7,000 a month for that tribal member to be on Humira through that self-funded health plan. Well, getting 340B, now you'll have that avenue for the tribe and not only have that ability to save significant amount of dollars.
One of the key things is they should be a patient record.
Oh, that is the...
Yeah, great point.
You'll hear pharmacists go, oh, no, not 340B, oh, it's awful, sound the alarms, don't do it. If you have a pharmacy, you'll hear that from your pharmacist. But when they get into it, they realize they don't have to meet all the same requirements that you have to if you're a hospital or a rural health center or a FQHC. So basically, all you have to meet is they have to be a patient of record of the clinic, and you can do MOUs with specialty clinics. So if you're doing PRC, you have an agreement, so it's part of the continuity of care. So you'd be covered there. So remember, your requirements are not going to be based on income like they have to mess with on 340B with everyone else. So tribes are exempt from that.
My gosh, who wants to get in the drug business? So I have a question. So if we have let's say a casino, for example, we have a healthcare plan. We're utilizing 340B, right? We're paying $7,000 a month, and now we get it for a penny. What will happen to our healthcare plan the following year?
Yeah, it's obviously going to significantly lower for the tribe. Those costs are, again, the tribe, if it's on a self-funded, that means the tribe's self-funding the health plan. So those costs are immediately opportunity for savings for a tribe. And that's, again, we're just talking, the list that you saw isn't the only drugs at that cost. We just showed you an example. There's hundreds of drugs on that program that, can provide significant savings.
And I just think it's important because I don't know about you or our tribe or anything else, but our citizens ask us, when do we get benefits? How do we get to reap these rewards? And this is a great way for that to happen because now we can use that other money that we set aside for this to put back into our programs, to put back into our citizens, into the wellness, into longevity, to pull out that 7 generations, to make sure we're making something sustainable for them because casinos are not going to be the only thing that's around, and at some point it's going to dry up a little bit. But we have to be able to sustain that for future generations and give them different opportunities. And this is one way to do that.
That's well stated, Marcy. Keep in mind too that the IHS program with the VA Prime Vendor Program, you can only use those medications for tribal members. But on 340B, it can be used for non-natives as well, as long as they're a patient of record. So if you have your employees and you want to do an employee clinic, you have your employees, you can easily take care of those people without any problem. So it'll lower your costs straight across the board.
That's
This
amazing.
is true, but you need to have that 813 resolution in place, right? The authority to serve non-natives from your legislative body.
Excellent point, Martha, with that tribal resolution, which is exactly what Marcy talked about earlier. So there are a couple of resolutions you'll get, but it's all to support the programs you want to do.
Chairman, what are some of the check boxes? We kind of touched that base on it a little bit, but just real quick, check that we have to do to make sure that the resolution for this.
Sure, I can touch briefly on that.
Yeah.
I know we're short on time, but basically, just to reiterate, Marcy and everyone has been saying, on the tribal side, you need to make sure you get the processes in place of the legislators or council, whatever is there, and making sure that you have the steps in place based on what's outlined in your constitution or your governing documents, and that allows you to take those necessary steps. And that in itself is going to give you your checkbox or your checklist, I should say, because you can look at this, the outline of what it would take, but you also will have contingencies because there will be unforeseen factors that come into play. And so you need to just make sure that you have all those individuals in place. While I have the microphone, I would like to introduce Dr. Randy Smith. If you would stand or just wave. He's our Health and Human Services Executive Director for our tribe, and he's been very instrumental in this process as well. And I'm just glad that I wanted to make sure I pointed you out today that because once this all takes place, once we move past this, then he will be taking that on for the next steps of implementation.
Yes. What an amazing opportunity, right? So where we start here to here, raise your hands if you want to get into the drug business. I mean, you mentioned the legal drug business. We can sell prescriptions to the community around us. Here's the thing to remember. The tribes, we now have the opportunity to lead healthcare. You have everything in your toolbox to do it. The goal is just to get started. Not sure how it works, just get started. But make sure we're communicating. The chairman mentioned, we have to communicate within a tribe, right? No more politics. We know over here on the executive side, legislative, we want to communicate. So let's just open up for questions, and just a quick reminder, this is part one. Part two is going to be later today. I want to see everybody there who's going to have questions. We will learn more. So let's open up for questions.
Ron, I just had a quick comment, real quick. One of the things I really just want to reiterate, I know that we have, we're limited on time, but as someone who was the vice chair for our casino board, I understand the functionality of that and that revenue, but we also, as tribes, need to learn and we need to be able able to find partners who are working with us, not vendors, that want to use casino money or our funds and really keep our best interest. And if I can't say this enough, take the time to do the research for what works best for you. I'm not just blowing Almay out of the water for that. They are our partner for that. They were able to step in and help us where we needed that help, but they've been great partners, so you need to make sure that you find someone that is a good partner for your tribe. But you can start with anybody, and you can always ask them questions. They're more than willing to answer those for you, so.
What is Almay meaning on this number?
Let's go.
Let's go.
All right, let's open up for questions. Who has a question? Raise your hand. Shane's gonna come over to you guys.
John has a question.
Part of the cost with the 105 as far as rental, the rental agreement, when I looked into this actually like fairly recently, and had conversation with IHS about whether or not costs of design and architectural are covered in that as well. Can you touch base on that?
On the 105 lease for BIA or IHS or?
I would like IHS.
IHS.
Architecture,
Yes,
drawings,
fine.
everything like that.
Martha, I have not.
What is the expense of entering a 105L? Is that your question?
But taking on a facility, or moving a facility, let's just say, Title VI, moving
Oh,
into
okay.
their own, building, more adequate for what you're trying to accomplish there. There may be architectural, design, mechanical, all of those costs, I think also included in, and can be included in the cost of alteration, I think is where you can actually add that to that as well.
So when you take out the loan to construct your facility, and that's included in the cost of that construction, yes, what's eligible is the principal and interest of that loan to stand up that facility. The other expenses is, as far as expense goes, is that getting those appraisals. And it's really hard to get appraisers out to Indian country, across Indian country, but we've been working with a group that has really helped and been able to get those costs of the appraisals down through the broker's opinion process, and they're accepted by the agency for that BPO, and getting them the best comparable rates to get you the best rate if you're doing an FMR. But under what you're saying, the construction of P&I under option C is where that's eligible.
If you are not taking a loan or anything, you're looking at the fair market value, and you're looking at expenses on that. And I know that with that, I don't believe that would be covered, would it? If you're doing a fair market value for that, like if you, yeah, only if you're doing a loan.
Oh, hold on.
What if the tribe already owns a building? Can they sublet it to one of the entities within the tribe?
I'm sorry, one more time.
Can they sublet it?
Yes.
Yeah.
And that would
Yes.
allow the tribe to actually reap the benefit of
Yes.
Yeah.
like a double
Yeah.
whammy.
You know, what's amazing is, in California, it's what, $65 a square foot? So if you do a building, the IHS will help that, it's $65 a square foot. So let's say it's 10,000 square feet times, let's say $60 a square foot, you're gonna get 6,000-7,000 a year for perpetuity for that building. It's amazing.
We have one more, time for one more. Yep.
One more.
So to follow on that gentleman's question, if you've got a A&E team coming on to help with the pre-design or the development of the project, if you've got a senior construction role and that includes pre-design on that can be captured as part of this, correct?
If it goes into the loan.
Yeah,
Yeah.
that would go into the loan.
Yeah.
That pre-dev money would go into the
Yeah.
loan. As long as it's baked in, you're
Yeah.
good is what you're saying.
That's right,
Yeah.
that's right.
Awesome.
So let's say we want to build a $5 million building, it's, I don't know, just 20,000 square feet, times 60,000 in California, right? $60 times 20,000 is what? 1.2 million, right? So it's $5 million for the building, you got your architectural designs, your building, everything into that loan, and now you're gonna get $1.2 million a year perpetuity. Pay for it.
I would also add
That's
one
amazing.
quick story that we've run into. This happens repeatedly all over the country. Tribes may have a real estate department or have someone they want to work with who does a commercial appraiser, which is a shortage of them nationwide, so you can do a broker opinion on those. And that'll go from the licensed broker on that. But if that broker has access to rental values, that's probably the key thing. But we had one tribe that we did it on, and they were gonna get $989,000 for all their buildings. Well, we looked at the rates, and it was kind of low for the rental values, and the commercial appraisers do a bang-up job for the sales value. I mean, amazing. They're a lot more expensive, but they do provide all of that. But we went ahead and had them look up the broker opinion where they had access to that fair rental market value, and they brought in, instead of $989,000, it's $4.25 million. So I mean, it's worth getting someone to do that for you and pull that in with those really good rental rates, if that's what you're going to fair market value.
Okay. Thank you everyone for being here today. I hope to see you this afternoon. Thank you for our panel. Thank you, Jeff.